Hey, how do you do? Wab Canoe with another healthcare update for you. So sometime in the last 24 hours, someone has deleted a video that basically laid out a bunch of the deletions to nursing jobs that are coming for HSC and the Children's Hospital. Now, when we looked at this video, the reason that they deleted it is probably because it contradicts what government's been saying so far. So first off, the video talks about nursing positions being deleted in children's emergency. Really? Also, pediatric intensive care, a unit called CK5, which does haematology and oncology for kids, so cancer care for kids, as well as nursing positions being cut or deleted rather in adult dialysis and adult mental health. Now, the government's deleting these positions. They say that every nurse will be able to find a job, but what guarantee is there that on January 1st, when these changes take effect, that people in those positions will have the right skills to care for the kids or the people in their units, right? Nurses are highly trained, they have specialized skills, and you could be highly trained in one area, but that doesn't mean that you could come in and deliver chemotherapy to a kid on day one in your new job. And so has the government responded to this and announced anything in terms of safeguards to make sure the right people have the right skills? Have they talked about anything to ensure that there's training for these nurses to prepare for the new jobs? No, all we have so far is a deletion of the video about the deletions. Now, significantly, the other thing that stood out in this video is that you have insiders, people in management, talking about the fact that phase one was quote unquote stressful, talking about how this is a difficult time. That's their language that they're using. And that's significant because it totally contradicts what the government's been saying about these healthcare cuts and closures. The government's saying everything's fine. Now we hear from the inside that that's not the case. And the final point that stood out is the fact that they announced that these nursing positions, these changes, the nurses are going to have to go choose their new jobs in what's called the tunnel room. This was used in phase one. A lot of people had to go choose your jobs. So if you do get deleted, you got to go down to this underground tunnel in front of your coworkers in plain view. You got to go up there and try and find your new job. To me, that doesn't seem respectful. It doesn't seem the right way to be caring for the people who care for us in our moments of need. So we know that Manitoba can do better than this. We can have a healthcare system that focuses on prevention and keeping people healthy at home. But importantly, we also need a government that values the people who deliver healthcare in our province and who know that healthcare is about taking care of people, but also the people who make our healthcare system work.